now give you more detail around our breaking news story. The World Health Organization has declared monkeypox a global public health emergency. The health agency says the classification comes as the outbreak has affected over 15,000 people in 72 countries. The decision comes at the end of a second virtual meeting of the WHO's emergency committee meeting on the virus today. A surge in infections has been reported since early May outside the West and Central African countries, where the viral infection has long been endemic.
In short, we have an outbreak that has spread around the world rapidly through new modes of transmission, about which we understand too little and which meets the criteria in the international health regulations. For all of these reasons, I have decided that the global monkeypox outbreak represents a public health emergency of international concern.
For more on this, I'm joined now by Dr. Aslam Dasoo, a medical expert and convener of the Progressive Health Forum. A very good evening to you. Thank you for your time. More than 16,000 cases of monkeypox have been reported across 75 countries so far this year, and the number of confirmed infections rose 77% from late June through early July. We know that the UN agency declined to declare a global emergency in response to monkeypox last month, but the story has now changed. Did we see this one coming?
Good evening. Thank you for inviting me. First, let's be clear that, even though we know about 17,000 cases, the likelihood is that the number is quite a lot higher, given that testing hasn't yet been scaled up, and that often this illness can be just a mild illness without the obvious signs that we all know and see in our pictures every day. So whether we could see this one coming, sure. I think the fact that it was discovered to have left its endemic regions, which were, as you pointed out, was West and Central Africa, and has been found in other countries, already, stimulated a huge oversight on this around the world and by the WHO, and they've been tracking this very closely. So in that sense, yes, we could see it coming. Declaring it, however, a public health emergency of international concern doesn't actually change the course of this. What it does, though, is that it invokes the international health regulations to which all the countries are signed up to, and that invites them to now create interventions and coordination mechanisms, both within their countries and for international surveillance, and put the resources that are needed for that into play as the disease now progresses. So I think that's the immediate situation. As far as the illness is concerned, the monkeypox virus is part of the family of viruses that include smallpox as well. And it would tend to, at this point, seem to be prevalent among the cohort of men who have sex with other men, but it is not, and I must stress this, exclusive to that cohort. It's been picked up among many other people, including in certain rare cases in children. So this may be an evolving situation that tells us that this virus could have far more widespread implications. It's important to understand that most of us who are over 50 will have had the smallpox vaccine, and that would confer some degree of protection to that group of individuals. But that is by no means a secure immune response. There are vaccines available, but they're not enough as yet. I think only about 20,000 doses that are available in the United States, we know, and I'm not sure about the other countries. In South Africa, we've picked up 3 cases so far. So, we'll be watching that. And I think we're all on a watching brief as far as this.
Absolutely. Dr. Dasoo, if you'll allow me there just to interrupt you. I mean, you speak about the concentration, men who have sex with men and those with multiple sexual partners. Surely that now should speak to some thoughts around the strategy and the work that needs to be done to stop this. What do you believe to be some of the answers there?
Okay, as we've learned, even with COVID and with other epidemics over the years, that the most important first step is to have a sound and a smart communication strategy that's targeted and directed to where the threat is the highest, to empower people to be able to take care of themselves. You never go into a war with a virus thinking you can beat it. The best you can do is to protect yourself from it. So if that would mean behavioral change, and as we saw during COVID, urging people at the time of the surges to wear masks, to social distance, etc. Similarly, here, targeted communication to those communities which, seem to demonstrate a prevalence of this illness is your first most important step. Of course, that is predicated on a widespread surveillance system, notification system of outbreaks. And I think as testing will start to increase because of this declaration, we're going to see the numbers increase without a doubt. But I must stress, we are not in the league here of the coronavirus pandemic. This is not a bug that is spread through respiratory pathways. It is spread through intimate, prolonged physical contact with infected people. And of course, that would mean that its rate of spread is going to be nowhere near what we saw with COVID. So it's important that there's no unnecessary alarm over this.
Yeah.
Caution, yes. Surveillance, yes. Targeted communication to make sure that people understand the illness and can take the measures necessary to protect themselves from getting infected. That would be the mainstay at this point.
Researchers are saying monkeypox patients around the world are suffering from symptoms not normally linked to the virus, which is leading to missed or perhaps mistaken diagnosis. Doctors are reporting that some patients with only single sores from the disease, sometimes in the mouth or genitals. We know the disease was detected here in South Africa. The first case, the 30-year-old male patient from Johannesburg with no history of having traveled. Are we at risk of perhaps a misdiagnosis? I mean, perhaps maybe just expand on how the diagnosis process would work.
Well, I think the illness has a particular pattern of symptoms that, and it's a range over a period of time. Initially, there's a prodromal, what we call a prodromal phase, where you may feel nothing, or you may feel very mild symptoms, and then you come to the vesicular phase, where the outbreaks, the lesions on the skin appear. And for those of you who've had smallpox, it's a similar kind of process. And so I think diagnosing this is not going to be too much of a problem. And I think the testing will confirm diagnosis very quickly, and it is PCR testing. So, and countries are well versed in PCR testing. So I'm not too concerned about that. I think what is important to find out is the degree of prevalence at this point. We picked up 3. There may be a lot more. In fact, we can be certain that there may be a lot more. But as soon as the outward symptoms appear, it becomes pretty diagnostic. And there must be a call made to people who are at risk to immediately seek medical attention if they start feeling high fever in particular, which is a characteristic feature, and then, of course, the skin lesions, and to seek medical attention and to get tested. And I think that will help us because it doesn't spread at the rate, for example, COVID spread. Contact tracing in this instance will be very valuable because, the cohort you're looking at is much smaller. So I think at this point, as I said, there's no need for alarm. Our authorities here are completely au fait with it. And in fact, we'll hear from the NICD, I'm sure, shortly, on the official process that they will outline to manage this. And we should take guidance from them when they do. But there is no need at this point for alarm at all.
Historically, monkeypox has spread at low levels in remote parts of Western Central Africa where rodents and other animals carried the virus. The pattern is clearly changing with the current monkeypox outbreak now spreading widely in North American and European nations where the virus is not normally found. What does this essentially mean for South Africa? I mean, you make mention of the degree of prevalence in South Africa, something that one needs to watch out for.
Sure. I think what you allude to is a very important element and doesn't only affect monkeypox. Even COVID and the series of pandemics we have witnessed over the last 50 years are all a result of zoonotic infection where there has been a species jump from animals to humans. And that comes from increasing contact between humans and wildlife. So our wanton destruction of biodiversity and increasing encroachment on natural habitats make us prime prospects for increasing numbers of zoonotic infections. So that's essentially where monkeypox would also have emerged. However, the fact that it's appearing now in other countries means that it's being spread by international travel. 100 years ago, the spread would have been very different. It would have taken you on a ship weeks to get to another destination. Today, it's instantaneous almost. And of course, the concern is that if there's, unprotected sex happening among people, that the ability to pick up the infection and then travel to another place and then manifest the disease is high. And that's precisely what has happened here in this situation. And I think once we begin to get a handle on the numbers of cases, we will be able to then put in the correct therapeutic strategies, including antiviral medication. But I think the need for mass vaccination on the scale of COVID is certainly not in the offing yet. And I think this declaration by the WHO, and it needs to explain its rationale, because we understand that the advisory committee did not actually develop consensus on this declaration, but the WHO will clear that up in a short while, I'm sure, and should be able to then tell us why it took this step precisely. And there may be factors that we are not yet aware of that made it do so. Until then, I think we are pretty much in the same situation we were before the declaration,
yeah.
and our understanding and knowledge of the virus hasn't changed. But what it has done is alerted our authorities to the prospects for higher numbers of infections and the need to deploy resources in a coordinated international effort to prevent an unprecedented outbreak of the virus.
Absolutely. Thank you so much for your time. Let's leave it there for now. Dr. Aslam Dasoo.